Hi, this is Dr. Chandramohan from Sri Samraj Physiotherapy Center, Dindivanam, Tamil Nadu. A warm welcome to all Indian and abroad participants, many are students, few professors and clinicians. This is our 7th webinar and first on web series starting today. The topic is functional stability of spine by Dr. D.M. Manoj, MPT Sports, Director and co-founder of PhysioActive, the Wellness Hub, who worked with 15th Asian Games Women's Indian Hockey team and formerly head physiotherapist of physiotherapy department at Timis Hospital. Presently working in PhysioActive and having 18 years of experience in our professional field. This webinar is organized by Sri Samraj Physiotherapy Center, Dindivanam, Fitness and Rehab India YouTube channel, exercise testing and prescription website ExRxIndia.org in association with Dr. Rupesh, Peak Health Studio, Chennai. I welcome co-host Professor Duna Saha from PD Women's College, West Bengal. Now it's our turn to listen to Dr. Manoj. Dr. Manoj, please start the session.
Right, okay. Chandra, thank you so much. When I started my physio, when I first entered the college, I remember Chandra is the first person I met. He also remembers that. So,
Yes.
So this is we are talking about 1997, I think. Yeah. So nice to be again in touch with him. And yeah, hi to everyone. Thanks Rupesh and thanks Duna. Hi to everyone, students, therapists. I'm very excited to meet you all because I've been in clinical practice for all these years. Excited and I'd want to know also how this has been a gap of 18 years. How this new age students are. So we'll interact for some time at the end of this presentation. So yeah, means we have heard a lot of presentations. Yeah, I've heard a lot of presentations. If you ask me, do I remember anything? Not much. So we have got a lot. As a student, we have listened to a lot of lectures and presentations. But what I remember is that the style they did, the concept they made me understand. That's what I remember actually. So today, the same thing. I'm not going to bore you with a lot of informations. The informations are available everywhere. But what I would want to do today is that share the experience, share the patterns which I've learned over a period of time. Maybe that will help you practically do your clinical practice in a better way. And also let me just keep it short. Also, we'll interact more after that. So yes, I think let me go ahead with the presentation. Let me start the screen share. Allow me to screen share. Before I start screen sharing, if I can just quickly know how many of them are students. If you just students, just put S. If it is physio, you can just type it P quickly in the chat box. Student S P 1P, right? Okay. So yeah, I seen a lot of SS actually. Guys, fine, fine, good. I think it's 98% seems to be S. so it's student. So I'm going to keep it simple and easy. I'm not going to complicate with too many tough terms. You'd be in touch with your anatomy and all those things, but I'm going to teach you the concepts now. Right? Thank you, guys. Thank you. I saw it. It is 98% students. I just saw 2 Ps. It was very fast. It was lightning fast, but I saw 2 Ps, which is physios. Yeah. So let me share this presentation. Let me go to the first slide. Yeah. So if you guys can see, Chandra, can you just, can you see the screen?
Yes, sir.
Yeah, thank you. Right. Yeah, thank you. Right. Last presentation, I didn't open the screen. I was just going in a rhythm actually. Then later I found out that I had to open the screen. Okay, so I'm just double confirming. Again, like Chandra introduced, I'm DM Manoj, I'm sports physio, and I'm state director. That's my team. That's PhysioActive. That's my team of therapists, and we have a nutritionist also. We focus on ortho, spine, sports, and holistic nutrition. Right. Okay. So, what is the reason I'm here today? Yeah, we are going to speak about definitely the core stabilization, but I just can, if I can take few minutes to explain what is the role of physio going to be. I thought this would be very important because we had few rules initially, but I see that as a physio, our roles are really going to go up. I'd say physio to be the future of non-chemical management of any musculoskeletal issues. Not only musculoskeletal, we're going to go step up also. That is what I want to speak about, which is about genetics, environment, and poor lifestyle. And yes, how important is that lifestyle changes and regular exercises, and who is the best person to emphasize? I think physio is the best person to emphasize about exercises, right? Exercises. So exercise as medicine, movement as medicine. Yes, that is going to be the future actually. So let me take few minutes to explain you that. Right. Okay. So if you could see, if you could just for a minute see what the global cause of deaths in 1990. If you see that, it is communicable disease 33%, injuries 10%, like road traffic accident, all those things. Non-communicable disease 57%. What are non-communicable disease? Disease like diabetes, hypertension, that is everything is non-communicable disease like cancer. They're all non-communicable diseases. Communicable diseases, the COVID. The COVID is a communicable disease, right? If you see the same thing at the next thing, the global cause of death in 2016, you see that the injuries has gone down. Means your hospitals are better. They're able to save people from RTAs. When they come with RTA, they're able to save people. Communicable disease, yeah, it has gone up recently because of this COVID. Otherwise, see how much it has gone down. So our cleanliness, I would say, it has improved. The way we live has improved. So the communicable disease has gone down actually, except this COVID. Uh, but if you see the rise of non-communicable diseases, it has gone to 72%. That's really a big rise in non-communicable disease. Diseases like diabetes, cancer, hypertension, thyroid diseases, stress diseases, musculoskeletal issues. They're all non-communicable. You see the rise. Now, what is the relation? Why am I talking about this one? If you see that there is three important factors actually: the genetic factors, the environment, and poor lifestyle. These three factors are the reason for this increase in numbers. Now, the chronic disease, we call them as chronic disease. You see the statistics of so-called developed country. This is the statistics of US. 6 in 10 people have chronic diseases. 6 in 10. And 4 in 10 have more than 2 chronic diseases. Like heart disease, cancer, chronic lung disease, strokes, Alzheimer's, diabetes, chronic kidney diseases. They have gone in numbers actually. Right. Okay. So right. So I said three factors. The first is environmental factor. The pollution, water is polluted, the air is polluted. We breathe in that air, and that's the cause of all those non-communicable disease. And even though this COVID has caused a havoc in everyone's life, if I could just take a minute to look at this one, I'm in Delhi, I'm close to this place. One of my friend told me that from Roorkee, he's able to see Himalayas after 30 years. That's the clarity of the air actually. And the water bodies are much better. People are able to breathe better. There is a lot of cough which is related to bad air actually, allergic coughs. They have gone down. So this COVID has really changed the environment in just 3 months. They say that what had become a problem in last 30 years, this is able to change it in last just 3 months. So why I'm focusing on this? Environment. If this environment is good, we are able to reduce this non-communicable diseases. So from this point, we need to also focus on how to maintain the environment. Okay, I'm not going too much into that. Right, genetics, which is acquired and innate. The way you sit, if you're slouchy, or if someone is slouchy, if the patient is slouchy, ask them. If the kid is slouchy, they're going to tell, yes, my mom also has the same posture. And mom and dad have diabetes, the chance of having the kid having diabetes is 50%. So this genetics also play a vital role. But if you have a good healthy lifestyle and if you exercise regularly, you make sure that the offerings are definitely healthier. So we are taking care of two aspects already. The third aspect is the physical activity and exercises. So if someone is doing regular exercises and is physically active, see the impact. There is like 60% reduction in musculoskeletal problems. As a physio, you'd want to do that, prevent the society from going into all these problems. You see, the medical management is through drugs, surgeries, and injections. Now, what do? They do symptomatic relief actually. If the sugars are high, if you take medications, the sugars are going to go low. But the moment you stop medications, the sugar is going to go up again, the blood glucose. Hypertensive, your BP is going to go up. The moment you stop medications, the BP is going to go up. So what are they? They are symptomatic. But if you want to go to the real root cause and treat the problem, that's through physical activity and exercise. If you want to prevent someone from having these problems, you need to have this one. If someone is already diabetic and you want to take care of them, then again physical activity and exercises. So what are we? We are movement therapists, and we are the one which I see in the future is going to lead this one in terms of managing all these problems. And you saw the rise, how much it was going up. So as a physio, we have an important role. That's what I want to emphasize. Okay. Now, yes, I emphasize on those three aspects, which definitely I want to do as a part of presentation, because you're all students. You just can't be sticking to, yes, I want to treat pain, this, but we've got more role. We need to build a healthy community. Yeah, so that's our role actually. It's just not treating pain. We need to see the future more than just treating pain. Okay, but now for this presentation, let's understand pain. Pain is one thing which is stopping us from doing anything. You ask the patients, they say that, yes, I have pain, I'm not able to do exercises. Yes, I have pain, I'm not able to play the sports. Yes, I have pain, I'm not able to go to gym and keep myself fit. So if I could just take a minute to explain pain, you know that pain is an unpleasant sensory experience. But the pain is felt in the brain. It is just not the tissue damage, but the way your psychological condition, the area which is injured. If you feel that this area is important, for example, they say that someone is playing a piano and his fingers get injured, and he will show that symptom to be like 30% more than what others do. So you have a finger injury, you would not mind much. As a physio, imagine that your thumb is injured. Yes, that's very important to you, because that area is very important. So pain is just not a single this thing. It is multifactorial reasons. So as a physio, we spend time with patients so that we can understand the pain. You don't expect the other these things to spend a lot of time with the patients. As a physio, we have to spend a lot of time with the patients in assessment, in treatment. So if you really understand the reason of pain, I'm telling you, the treatment is easy. The treatment is very easy as a physio. There is a lot of techniques. We have a lot of tools coming into physio's hands now. Manipulations, dry needling, soft tissue releases, whatnot. And so that's why if you understand the person as a whole, we will be able to treat them better. So pain, it happens because of two reasons: an actual tissue damage, right? And suppose you have an ankle strain, there is a tissue damage, and you have pain there. Now, what is the reason of pain there? The pain would want to protect so that the body can heal. That's one reason. The second reason, this is the 80% of the time, if the thing is suspecting any tissue damage, or if the patient is feeling that he might have, then he is very protective. He just does this movement, and the spasm also can cause pain because the body wants to inhibit actually. It's like, for example, if you could just compare it with pain is like a signal, red signal. If the train is passing by, definitely, yes, there is a red signal and you want to stop. Sometimes even the train has passed, the light might be still, the red, it didn't turn green, but you need to see right and left and see whether the train is passed, and yeah, it's passed in front of your eyes, then you could just cross the road. You do not wait for it actually. That's how the pain is. Not always it is because of mechanical damage. Yes, people who come with an ankle strain, you just ask them to rest because the pain is there to heal. But someone is coming with a back pain, with which came because of a bad posture. Do you want to stop them from doing activities? No, you'd want to go ahead and definitely ask them to do activities to get rid of the pain. So it is important that the pain should not be stopping from you exercising or your patient exercising. So understand where the pain is coming from. Is it for protection or it is for something else? If it's for protection, allow them to heal. Otherwise, you just go ahead and help them do exercises and overcome that fear of having the problem. Right. So now, Bryce, this is the topic. Yes, I took a lot of time in the introduction because I wanted to emphasize on our roles actually there. Now we are going to discuss about the functional stability of the core. Now, this is little practical concepts, and I follow certain people and I applied that and I found really good results. So I'm discussing about this concepts actually. You know that we have cervical, thoracic, lumbar spine, and the coccyx, the tailbone, the sacrum and the coccyx. So in this, you know that cervical spine and the lumbar spine, they have most of the problems. Any disc injury is in the lumbar spine or in the cervical spine. You have neck pain and back pain. Mid-thoracic pain, very less. You don't see very often. Why? What is the reason? Can anyone just type it? What is the reason? Why we have more cervical problems or lumbar problems? Why is that? Am I able to see this? Okay, I think you guys are answering, but I'm not able to see it. I'll just quickly check. The lumbar spine and cervical spine is mobile. It's too much mobile as compared to the thoracic and other areas. Now, if there is a lot of mobility and there's a lot of wear and tear, that's the reason for pain there. Now, traditionally, as a physio, what do we do? If someone is coming with a lumbar pain, lumbar spine pain, what do? We put them on flexion exercise, extension exercise, rotation exercise, that exercise, this exercise. What are we doing? The problem is already there is a hypermobility. Again, by making them do all those lot of mobility exercises, you make that condition maybe temporarily okay, but permanently it is going bad actually. So this areas, yes, they might need mobility. If you find out I'm not telling that mobility is not needed at all, they might need mobility, but they need more stability than mobility. So that's why you need to understand this concept of stabilizers, static and dynamic stabilizers. There are static stabilizers, there are dynamic stabilizers. The static stabilizers are the ligaments, the joint, the capsule, all those things. The dynamic stabilizers, the muscles. So bringing stability to that area is the solution to get rid of the problem permanently. So that's why we would want to discuss about functional stability of core and the concepts of it. You know what is the core? The core comprise of this anterior muscles, the lateral muscles, and the posterior muscles, the up, the diaphragm, and the lower, the pelvic floor. They all combine together and form a core. And what is the function of the core? Do you know that? The function of the core is to stabilize. You take any activity, like suppose you're sitting, or any sports like cricket, football. The trunk works like a stability or the base on which your limbs move. The stability can be a static stability or a dynamic stability, but that is a stable segment on which your limbs move and deliver the force. Even if you're sitting in front of the computer, you're not moving your spine up and down. You are stabilizing the spine for a number of hours. Yeah, it is not good because you're not supposed to sit for that long, because you'll affect the nutrition to the disc and make it weak. But what is the activity is happening? You are sitting, you're not moving. So the function of the core, this area, is to stabilize. Imagine that you're standing and throwing a ball. How many people play cricket? They might know this. You're throwing a ball, and the amount of distance it will reach, you measure that, and I make you stand on an unstable surface, like a ball, or ball would be difficult. Imagine any unstable surface, and I ask you to throw the ball. Which one do you think will reach far? Standing on a stable surface or an unstable surface? On a stable surface, because only then the force can be transmitted effectively to the limbs. So that's the core. The core work is to stabilize. Suppose if you're a boxer, all the force is coming from the shoulder and you give a punch, but definitely the force is translated from the leg to the core to the shoulder to the wrist. While the punching is happening, or before the punch, the core is stabilizing. It is like a stable platform on which you're able to deliver the force actually. I just need
There
that
is
much
question,
time.
sir.
There's a question. Please go ahead. If you just ask, I can clarify them.
Best core stability exercise from Shravani.
Best core stability exercises. Okay. So that's the concept I want you to understand here. And then at the end of it, you'll be able to decide what is the best core stability exercise actually. So hopefully that's the reason we are presenting now. And there is no best core stability. Suppose someone is having a six packs, his rectus is super active, right? You know that as a physio, you know that rectus is just one part of the core, right? You think having a six pack is the best core stability exercises? No. And what you do as a physio, you understand where the weakness is. That's the difference between a physio and a physical trainer. Actually, a physio can identify the problem. The moment I identify the problem, you know which is the best core stability exercises, right?
How to strengthen core muscles,
Yeah.
which exercise we can give to patient to increase core strength?
Okay, so yeah, again, right. So I'm really not talking about that one exercise. Doctor साहब एक दवाई दे दीजिए सारा बीमारी ठीक हो जाए. No, I'm. So guys, you are asking me about what is the best exercise. Yeah, if there is one best exercise, would not everyone follow that best exercise? And सबको वही देते रहेंगे हम, है ना? So I'm sorry, I went into Hindi because if there was one best exercise in the world, then why would not everyone do the same best exercise? So there is nothing called one best in anything, I feel, actually. Yeah. So it's a mixture of everything, and you need to, as a physio, as a medical field, we need to identify which is the one best exercises for this person because of which he is suffering, and that is going to be the one best exercise for that person. And that's how in medical field, actually each member is different, and there is no one thing which will suit everyone, actually. And that's not going to happen. If that is going to happen, I'll term it as all humans would become a robots till then one thing would fix everyone, actually. One chip would fix everyone. No, that would not. We are all different, and the difference is the one which definitely is like the difference in the fingers, actually. Yeah, that's the one which is helping us to survive, right? Okay, so let me talk about this core. We spoke about the anterior core, the lateral core, and the posterior core. We are going to discuss about what the muscles are, right? Okay. So what is the role of muscles? It's to mobilize. Yes, it is helping in movement and stabilize also, right? But predominantly, I told you the core is to stabilize. It is not mobilize. Yeah, there is some mobility aspect, but predominantly 80% is to stabilize. Yeah. Stability. Yes. What gives stability? The ligaments, the capsule. We discussed this already. The joint congruency and the dynamic stability is given by the muscles and neuromuscular control. A good example would be the shoulder joint. If I'd ask you, what is the function of rotator cuff muscle? What would you say? Someone can just type it. What is the function of a rotator cuff muscle? What is that they have typed?
Someone written dynamic stability.
Wow.
Kumal
Right.
Verma.
Excellent. Right. Okay. I think
Shipra
you're
Misra
on the
writes
point.
stability.
I have excellent students today, actually. Yeah, really, I'm telling you. Yes, even though there is interrotation, exrotation done by these muscles, but it is the one which provides dynamic stability, because the base, the scapula, is not a stable base. It is moving. So this rotator cuff muscles are the very important muscles which provide dynamic stability to the shoulder. Excellent, guys. On the spot. Right. Okay. So core, if you could just simply put it, anterior, lateral, posterior, superior, and inferior. Superior, diaphragm. I don't know how many people train the diaphragm, the breathing exercises, but that's an important part of the core. Pelvic floor. I don't know how many people train pelvic floor, especially women are prone to pelvic floor weaknesses because of a lot of issues. The post pregnancy or means any pelvic issues, they have this weak core because of inhibition. So again, if you focus on the pelvis muscles, there might be that's a part of the core. And the anterior muscles, the rectus, the lateral muscles, the rotatrus, and the posterior, the multifida and the extensor, the rectus spinae. Right. Okay. So how does this core work? The core works if you just take an example of a tent. The tent, the superior surface, or you'd go from the paraspinals and the multifidus. From behind, the supported by these two muscles, and in the front it is the rectus abdominis and the transverse abdominis, and in the side, which is causing rotation, is the external oblique, internal oblique, and the quadratus lumborum, which also causes lateral flexion. That is the front, back, and side. But if you see the top and the bottom, there's a diaphragm and the pelvic floor. So this is the core, and you'd want all these muscles to work in unison. If any one of the muscle is not working, for example, people who have a chronic back pain, they say that the transverse abdominis that goes weak, actually. People who have listhesis, or if they have unstable spine, the multifidus goes weak. So people who have pelvic issues, their quadratus lumboris goes weak. So you want to identify which structure is weak. Once you identify, you got to individually work on them, definitely, but get them to work in the group. So whatever the problem might be, you need to address that problem, and finally you would want to make them work as a group to get the core stability. Right. Okay, we focus on diaphragm and this one. Okay. What are the problems with traditional exercise? Typically, we just give them that you do flexion exercise, extension exercises. But we discussed this point already that lumbar spine is already mobile. We want it to be stable. But what we do when we do the flexion extension exercises, we focus on too much of lumbar mobility. Yeah, if someone has got a really stiff spine, yes, I'm not telling that you can't work on lumbar mobility. You need to start with that. But that's the starting point. That's not the end point. Then we do a lot of tummy tuck-in, abdominal tuck-in actually. We try to engage this transverse abdominis. So again, that's one part of it. But if you engage it too much, you're putting a lot of strain on the back also. And we focus on too much isolation. Like I said, people come for six packs. They ask always, how should I get six packs? You focus on rectus, rectus, rectus. Right, okay. If you do that, they might damage the spine. Right, and any exercises, we don't discuss about the neutral spine anymore. We do a lot of things in the spine the way it is, in flexion or in extension, the supermans which we give typically for extensor strengthening. You see, you just make that and just see the patient from the lateral view. You'll see that the spine is hyperextending in all the superman exercises. Again, we don't emphasize the neutral spine there. So these are the problems with the traditional exercise. And finally, it is non-functional. They're on the floor, they're doing a lot of exercises, and when they go and sit in the chair and want to work in front of the computer, the pain comes back again. So you just need to focus on the functionality at the end, because that is the reason you're doing all these things. So that's the end thing, right? Okay. So neutral spine emphasize. Let's go with what we need to understand here. We need to stabilize. We're going to discuss how in next few minutes. We need to stabilize and challenge that dynamically, and then we need to integrate all the muscles to work together. That's very, very important. We need to emphasize on the neutral spine. I'm going to show you how to emphasize on the neutral spine in a video. So again, this muscles, we focus on too much of strength. We don't focus on endurance. We need to focus on endurance of the core muscles. If you're sitting in a chair for 8 hours, these core muscles need endurance. With strength, they get fatigued too soon. So all these core muscles, you need to focus on endurance training. And you need to challenge the stabilization systems. Again, we're going to discuss with videos. And last, train for stability in functional positions. And definitely you really not worry too much about a single muscle. Yeah, you need those things, but that's the first thing, that's the starting thing, right? Okay, so how do you go with exercise progression? We start by adding by substitutions, which means we need to take those old exercises which I already made them do, right? They can't be doing a lot of mobility activities. You need to substitute them. You need to focus on the neutral spine. You need to focus on bracing. You need to focus on proper muscle use and bracing and moving the extremities where you challenge them, and functional movement patterns actually at the end. So let's go and check. Now we have one exercise for each groups. We can focus on this one. Now we're going to focus on the anterior and the posterior chain actually. So now, if you see this is a cat and camel exercise. Yeah, typically we do something called isometric abdominals, right? You want to teach that in supine lying when the patient is lying down. Actually, I think I'm one slide a little up and down, but let me tell you how we go about. You need to work on the mobility and other issues. If they have any mobility issues, you just work on them. But that's for the homework. You can just give them as a homework. What do you do in the clinic? In the clinic, you emphasize on stabilizing the spine. What is the best way to stabilize the lumbar spine? You make them lie down on the back and teach them pelvic tilts, and then tell them to stop in a neutral spine, not an hyperextended spine. So neutral spine, what is a neutral spine? You know neutral spine, but the patient would not know. You need to ask them to move up and down, and where the spine is flat, that's a neutral spine. You need to ask them to stop there. Once they stop there, then you need to teach them something called abdominal bracing. What is abdominal bracing? The bracing is the activation of all the muscles around the tummy and the pelvis so that they work like a belt to stabilize the core. How do you do that? You ask them to isometrically contract the rectus, the transverse abdominis, and gently breathe. Yeah. That's called bracing actually. So this is the way you make them see. That's the neutral spine. I mean, this is hyperextension and this is flexion. That somewhere is the neutral spine. Yeah, and when the neutral spine is there, not only rectus, you also ask them to activate the transverse abdominis. That's in the side and the rectus. Then I think I'm running fast. Okay, I'm sorry guys. That is, yes. Yeah. So now you ask them to find out the neutral spine. And once you find the neutral spine, you ask them to engage and activate the rectus and the transverse. And then you start moving the arms. First, you've made them understand the concept of neutral spine, and you're challenging the neutral spine by moving the arms. That's the concept which we discussed. Then you make it a little more difficult by asking them to move the legs. That's an hyperextension. You see that people doing all of that. That's not going to be right actually. I hope you understood this concept. This is going to focus on the anterior and the posterior chain both. Now let's take the bridging as an example. Yeah. Is that a neutral bridge? Yes. You ask them to bridge and then activate the core, which is the rectus, the transverse. That's a hyperextended spine. You don't want to do that. You want to align them by asking them to lift it up, and that's a neutral spine. And then you could just challenge by asking them to move the legs. That's going to help them control the pelvis. You see that pelvis drop there? That's a bad way of doing it actually. So you need to engage this. Yeah. What are you doing here? You're activating the glutes. You're activating the anterior rectus and the transverse so that your pelvis doesn't tilt too much. Now, the lateral chain. We spoke about anterior posterior chain, and here we are going to discuss about the lateral chain. This is a simple activity to start with. I'm not able to click the video. Just give me a sec. Yeah, there it is, the cursor. So you just ask them to, or that's the next progression, but you're activating the lateral chain. You can make it a little difficult by going up and bringing the spine to the neutral, and also you can just push the hips up actually. This is for the lateral chain activations. Yes, I missed the rotation. Yes, the rotation is on the wall. You just need the spine to rotate, and you want them to stabilize. This is the progression actually, where we have taken them and we're making it little difficult. This will be done on the floor first, where you activated the rectus and you're moving the arm up and down. You put a roll below to challenge them a little more. And again, you focus on the core stabilization, engage, engage, engage. Right. You see the challenge? It is rotational challenge. Also, it's just trying to stabilize actually. Yeah. So that's what we were talking about. First is neutral spine. The second is abdominal bracing concept. You need to make them understand that. Then the proper use of the muscles. Then bracing and moving the arms to make it challenging. Then you take them and do that same thing in sitting, which is functional movement patterns. Whatever the movement patterns are, you're going to take them and make them do exercises in those patterns actually. So this is how you progress with the exercise. How are you going to decide what the program? The program will start from the basics actually. And if they're able to do the basics, then you push it up. You challenge them through extremities. You challenge them through adding a ball to make it a little more difficult. You add resistance to it. You add weight cuffs on the hands and the legs. You add resistance bands. You do that in lying. You could do that in sitting. You progress to standing. You're standing on an unstable platform. So that's the progress. You start from simple and you can take it to the complicated movements, actually patterns. But the basic thing is you need to understand, make them understand what is neutral spine and abdominal bracing. It all starts from there. Abdominal bracing happens by definitely tightening the rectus and by tightening all the lateral muscles also. There you need to focus on the transverse and engage them before you progress with others actually. Um, right. Okay. Fine. That's the quick concept which I've explained. I think we just spent 5 minutes to discuss if there is anything clarifications, and then yeah, you need to just use these principles in, and you should apply. You should come out of this traditional exercises which you're doing, because we saw the disadvantage of doing the traditional exercises. The traditional exercise can be home programs, or it could be just an exercise. If you find someone really stiff, you could just ask them to mobilize. If you find someone's glutes very weak, you could ask them to do specific exercise for the glutes. That could be a home care program. But in the clinic, you're going to focus on this neutral spine bracing and progressively engaging, right? So assessment to find out the problem, and once the problem is found out, you treat that. Whether it's pain, he needs rest, he doesn't need rest, then take him to the neutral spine and bracing. Then once it is done, you want to progress to the level. Now till where will you progress? It depends on whether you're treating an athlete, you're treating a person who's going to office. But everyone you need to treat like a sports people, because you need to improve their performance actually. Someone is able to sit only for 5 minutes, you need to able to improve their sitting time for half an hour to 45 minutes. That's also a performance actually. So how do you do that? You start from the basic and you slowly progress. Right. I think we made little concept clear, but I think it needs a little more further discussion on this to understand the concept. So we'll just quickly 5 minutes to 10 minutes take questions actually. Yeah. Chandra, thank you. I'm done. And if there is any discussions, questions, we can take them now.
Yes. We can request the participants. Okay, somebody read the question for him. Host Duna Saha or Dr. Rupesh?
One question is
Dr.
there.
Rupesh, is it?
Is it necessary
Yes,
to
okay,
check static stability, and how?
Is it necessary to
Check static stability and how?
Yeah.
Sarban
Okay.
asked
Is it
this.
necessary? Right. Okay. Yeah. Definitely, it is necessary to check stability. How do you do that? These exercises, you're going to make them do that actually, and while they are doing that, could be used as an assessment. So if you suspect that, okay, your questioning, your examination, everything would tell you about which muscle is weak, and then you can compare that with the symptoms. Then definitely you take them, you make them do bridging, for example, and see whether they are able to hold the bridge or the pelvis is dropping. then you know that that's a problem. Okay, what is the treatment? You identify the problem, and that's going to be the treatment. So how do you identify? You ask them to do this one. One thing could be functional measures, which you do them like a squat, like a lunge, and all those things. But if you're doing with spinal conditions, you definitely ask them to do a bridge and a crunch, and if you want to check the mobility, you do certain aspect. But stability, I think the bridge is a good stability for the posterior chain. You need to see whether they are engaging the glutes up, and yeah, yes, that would be a good thing. And the all four extensions, that would be a good for checking the anterior stability. Yeah, and planks, if the patient you feel he's doing fine with the initial testings, you could also ask him to do a plank and check whether he's able to maintain that. But checking these basic movement patterns, you're going to know whether they are stable or unstable, where do they have problem exactly. Yeah, and
Okay,
you're
the
going to
next
use that as
question.
the treatment. Yeah,
The next question is this progression is same for post-surgical lumbar discectomy?
that's a good question. Right, okay. So now, um, if you do them, if you ask them to do flexions, number of flexions, someone is asking me also, is too much of crunches, is it bad? Suppose traditionally, what do you teach them? Knee to chest and flexion, the crunches, right? If imagine that the spine is in extension or in flexion, so if you do that too much, you are applying lot of load on the structure which is already weak. You got to follow the protocol first, the healing protocol. You know that when the disc heals, when they can do mobility activities gently, when they can move around, when they can start gentle static stability, like lying down and doing a lot of breathing exercises to engage the diaphragm could be one best exercise initially. So you need not really wait for them to come 3-4 months, but you could just start simple exercise initially where there is minimal pressure on the back. But the best part about the spinal stabilization is you are telling them to keep the spine in neutral. And what is the advantage of that? It is going to put less pressure on the disc as compared to any other exercises. You engage them extensions, you're going to hit those spines and really cause a lot of pressure on the facet joints. If you're going to put them flexion, they're going to do a lot of pressure on the disc actually. So they can't handle it. So again, you emphasize on the neutral spine and you emphasize on the bracing. So this is going to be the game changer for everything. But when you want to start that post-op, how big was the disc and what was the surgery done? There's a post-op healing process. You got to follow that. First 3 weeks you focus on a lot of breathing and gentle isometric engaging, all the stuff. Then as the disc heals, you take them to the next level. And this concept will be followed everywhere. And this is the best part about this one, that you compare between a spinal stabilization program and a spinal mobility program, you'll feel that a spinal stability program will definitely work better. Yes, mobilization program also will work better. So you need to combine both the approaches and see where this work and where this work, and you need to combine both. It's like you're going to do the knee to chest exercise, definitely. You're going to do the gentle spinal rotations, definitely. I'm not telling that you should leave that, but that's not the end that you start with. What is the end? End is bring the core. What is the purpose of the core? It's stability. So you need to focus on the stability. Yeah, I hope that answers your questions. Yeah.
Next
The next
question: can more repetition of crunches can lead to flattening of lumbar lordosis?
Lumbar lordosis. Okay, right. You know the Jandas cross syndrome, lower cross syndrome, right? So lumbar lordosis, you got to find out what is the reason for it. Is that your tight hamstrings? Is that your weak anterior core? Is that your tight paraspinals? Right? So stability is, yeah, it is there, but your assessment of what is the problem for that lumbar lordosis is the answer for this one actually. If you do too much of crunches with a lordotic patient, you know what, you're damaging them more. You're not helping them, you're damaging them more. So you have to identify why there is lumbar lordosis. That's going to be the skill of the therapist. Like I said, the knowledge is there, but we need to understand during the examination that why is this lumbar lordosis existing in him. Is it because of weak abdomen or something else? Right. Okay. So if you find out that it is weak abdominals, okay, just work on it. But again, you need to come back and stabilize. You can't use the single muscles to work and correct. No. I told you core means what? They work as a team. They don't work alone. If they work alone, that's not called core. That's called six-pack ab muscle and you have a back disc issue. No, if it is core training, they need to work as a whole. And if you feel that rectus is too weak, you bring it to the bracing, neutral spine, and engage the thing. But finally, you need to bring everything to work together by activating them. Yes. So doing one exercise would not definitely. And why is the lumbar spine lordotic? You need to understand the root cause of it. Yeah. But it ends with stability exercise. That was a good question, actually. Yeah.
Next, there is two questions from one participant.
Yeah.
Can you tell us how to identify the weakness of multifidus muscle, or is there any technique to identify the weakness of individual core muscle?
Right. Okay. Yes. You need to classify them as. It is easy if you classify them as anterior core, lateral core, posterior core, the diaphragm, and the pelvic floor. History will give a little bit of answers. Then a clinical examination would be giving a little bit of answers for you. Like I said, you ask them to do a bridging and see whether they're able to do a good bridge. Then you know that they're not using the right muscles actually. You ask them to use all four and ask them to do extension. You'll identify where the problem is actually. So you ask them to do that movement to identify the problem. Yes, you can identify, but don't go to the individual muscles too much. You need to check as an anterior, lateral, posterior, superior, inferior. That's it. If you go too much into single muscles, that doesn't lead you anywhere actually. Yeah, they used to tell that focus on this muscle, this muscle. No, but you know that if there is a lumbar instability, if there is a listhesis, their multifidus is going to be weak. But can you check the multifidus? Uh, to be very honest, it's very tough. It's very tough because they don't work as a single; they work as a whole actually. So I just focus on the extensors rather than the multifidus, and you know how to check that, right?
Next,
I hope that answers this question. Yeah.
next, if the pelvic or one side drops during bridging, does it indicate glute weakness or transverse abdominalis?
Right. Okay. Yeah. Good question. It's a combination. It's a combination of extension and rotation. A drop, I'll classify this as a rotation and an extension weakness actually. So you need both to hold it up there. But I take it is a combination of everything. But it is mainly for the extension you check. But like again, they work as a group, and you can't. They work as a group. Then you just need to check maybe on a wall. There's something called a wall elbow stance, and you just take one arm off and you see whether the body is rotating. Maybe you could just check that and see whether it's just a rotational stability or the extensor. So you could just go and check the individual muscles also to check what is happening, but it's more an extensor thing. And when you take the leg off and it drops, it's more of a rotational this things where you'd want to work on the transverse and the extensors also. So yeah, if there is not good extension happening, it's because of the gluteus. But after the extension, if it is dropping, it's more of a rotational stability issue. Yeah.
Next, what is the best pain relief for degenerative disc disease?
Okay, right. Okay. Mm, yeah. So there is no one best exercise for anything or no means maybe I didn't make you understand the concept. I'm sorry about that. I did my best, but no, there is no one best thing for regenerative exercises. All right, okay. I think, yeah, maybe I didn't make you understand the concept. Maybe I can just deliver it in a better way next time. But no, there is no one exercise for anything. Yeah, there's no one
Next,
exercise for.
yeah.
Yeah, yeah.
How to integrate these exercises in functional movement patterns?
Right. Okay. What is a functional movement pattern? Right. Okay. See, it's different for different people. Are you treating a person who's sitting in front of the laptop? Are you treating a lady who's in the kitchen and working like while dishes? Is there any problem with the back? She complains of, yes, when I stand and it could be men also. So when I stand and work in the kitchen, and I get a back pain. These days, a lot of men are doing dishes, so they may get back pain. So that's their functional this thing. Or if you're treating an athlete, so if you're treating a tennis player, that's their functional position actually. So that would be different for different people depending on what their functionality is. So you got to take them into their position. Like for example, tennis player playing that shot, you need to take them into that position and make them engage the core without causing a lot of mobility. Yeah, functional position different for different people. Yeah, from an office goer to a dishwasher to a cricketer. For example, cricketer keeper, it's a different. What is the functional position for a keeper? You need to bend and stand that for like three hours if you're, or 8 hours or 6 hours if you're playing a test match. So it's different for different people. So you ask them always, what do you do? The occupation will tell you what is the functional position, and you train in them in that particular position. Yeah.
Next question is from Dr. Jagadish.
Yeah.
What
I
happens?
think we have last 1 minute. Can we take one last question?
Yeah, then I'll give you some
We'll
other.
end this, right? Yeah. Yes. I
What
could.
is the reason why we get less Olympic medals despite of such a large population?
Wow, wow. You'd ask me a very big question, but I'll tell you one important thing as far as I know. Means, right, okay. You know what? India has good talents actually. I've seen them going. I've been with Davis Kapti for some time. I've been with them, but there's one person called Sure Mankad actually. So he was playing at a good level, but I come back and see him after 4 years. He's not there. I thought he'd be number one actually. You know what? He had a anterior knee pain and he lost his career actually. So I think the role of physio should be enhanced, and as a physio, we need to get enhanced first actually. And injury prevention. I feel injury. You know what? Training is one step closer to the medals. Injury is two step back from the medal. You know why now it is happening? Why we are not able to get? We are taking one step forward, but two steps back. That was a good question. That emphasize our role as a physio. Definitely. If you prevent injuries and okay, physio's role is also prevent and enhance. I don't know how many people know that. It's just not treating the injuries. You treat injuries, but prevent injuries and enhance performance. When you identify there is problem with the core, and then you work on it, you enhance their performance actually.